Thank you for joining us on our podcast about breastfeeding with Catherine. Today, I'm joined with Naomi Berkwowicz, who's a lactation consultant and registered dietitian, to talk about breastfeeding and all the challenges and stigmas and everything that goes along with it. So hi, Naomi. Thank you so very much for joining us today.
Hi, great to be back.
So let's talk about breastfeeding. Breastfeeding is a massive subject. So we're just going to talk about my experience, Catherine's experience, and maybe some, overall things to look out for and some explanations of, what went on there. Let's talk about when baby's born, you give birth, and most mothers, at least I wanted to try to breastfeed. That was my goal. So I tried for the first time and it was uncomfortable. I can't say that it was super painful, but it was uncomfortable. But I persevered. Much like Catherine, I got home and everything seemed to be going okay. Catherine did say that she felt right away at the hospital that something felt wrong, that it wasn't what she had experienced the first time around. And then a couple of weeks later, it was complete turmoil. She was in a lot of pain. Baby was latching, unlatching. She visited a bunch of specialists, and finally they've diagnosed her with overactive letdown. So first of all, is overactive letdown something that you see commonly?
I would say not as common as the opposite, like undersupply, underactive flow. I definitely see it. And it's usually in conjunction with something else on the baby's end where baby has difficulty managing the flow or the breastfeeding in itself, and the overactive letdown makes it even harder.
Okay.
But in her case, where it's kind of really the sole big issue, is less common from what I see. There might be other people who see it more, but just in my experience, it's definitely a thing. There's definitely things that we can do about it, and there's definitely management techniques. There are some supplements that people take to help. The science really isn't there to help yet. Just like with everything breastfeeding, we don't have great studies on this. We don't have great, clinical information. We don't have great treatment. These are kind of like, I heard this helps. Let's try it. So we do our best, but it would be great if we had a lot more, medical community backup with this kind of thing.
Okay. As a first-time mom at the hospital, I don't know, where people don't really know what they're doing, and they assume that it's a dance that baby and mommy have to learn and it'll get better when we get home.
Yeah.
And then when it doesn't get better, are there kind of red flags, or are there certain things that we should be looking out for to then call a resource or a lactation consultant? Obviously Catherine didn't know it was overactive letdown because that's so rare in your experience, but are there things that we should be looking out for so that we could kind of fix the situation, that like the challenge that we're having?
Yeah. So let's say starting out in the hospital.
Yeah.
The hospital is a funny thing because most people are there somewhere between 24 and 72 hours. Kind of the 24 to even now 48 hours after C-section is generally when most people leave. That's really fast after the baby's born. So those first 24 hours there's so much to do. There's tests for the baby, the nurses, the pediatricians, making sure the mom's okay, making sure baby's okay. And the focus, I would say, is yes, we have to feed the baby. But most of the time, unless the baby's really just not actually on the breast, actually latching, most of the time things go okay because it's a short period of time.
Yeah.
And the focus is make sure the minimum is alive.
Okay.
So the nurses and doctors are making sure that you're healthy enough to leave the hospital, because it's got to get in, got to get out kind of thing.
And are they looking at how the baby's latching on your breast?
So if the nurse or the lactation consultant has time, yes. It really depends the time of day. It depends the shift. It depends the season. It depends weekend. evening, night, day shift. Also, luck of the draw. If you have someone who's more experienced, who's on shift, on duty, you might have a completely different experience than someone who gave birth the same place, same time next day.
Right.
So there's a huge amount of variability when it comes to in the hospital. Also, within different hospital systems, things work differently. So there's a lot of differences when it comes to that. And a lot of the time, as long as the baby is has lost a normal amount of weight, not an excessive amount of weight, generally that's all it takes. And then everybody says,
it's like,
see ya, bye.
Good luck to you.
Good luck. Here's your baby. Good luck.
Nice.
So, in the hospital, the big red flags would be, elimination, peeing and pooping. They really look for that in terms of like the nursing and medical staff. The weight loss is probably the biggest red flag in babies. A lot of moms experience pain and discomfort, and it's, they work on the latch and they say the latch looks good.
Yeah.
The nurse really just does not have time to maybe delve deeper, even if it looks good, but it feels terrible. So the hospital, you could learn techniques, and they make sure that everybody is safe, but that's kind of
the bare minimum.
And if you get more than that, that's amazing.
Okay.
But really, it's kind of when you get home when things tend to devolve.
Yeah.
In Quebec, we're actually really lucky that the CLSC nurse comes within generally 2 to 4 days. That's when things actually reveal themselves a little bit more, and people get more help. So the CLSC nurse does have more time to spend with you. She comes to your house. She's in your space. So they have maybe more training with breastfeeding, I believe, than the hospital staff. I'm not 100% sure, but they see it all day, every day.
Right.
This is what they do. So they know. A lot of them are really wonderful, and some are lactation consultants. A lot of them are trained. They have to be trained in it. So a lot of the CLSC nurses are super helpful. And then a lot of them, if they know that there's more serious problems, they will refer them on, let's say, to go private or to the CLSC breastfeeding clinic or a community group breastfeeding clinic. And many of the nurses refer to the hospital breastfeeding clinics. So I would say that would be the main, like that person is the main point person, that CLSC nurse visit to start getting help. We see, I would say, 80% of problems in that first week.
Exactly.
Hospital, at home with the CLSC nurse. And then sometimes there are problems that show up later on. So where do you go from there? Well, the pediatrician.
Yeah.
Or sometimes the vaccine nurse can kind of help guide you.
Or you.
Or me. Yeah. So once you're out of the hospital system, after that week, you're not back really to the place where you delivered. And you've kind of lost touch with your postpartum nurse. If it's kind of between that 1 week and 2 months, you're kind of floating on your own. So that's where a lot of people look for lactation specific help.
Yeah. So I want to kind of go through a breastfeeding journey with you. I'll take myself as an example. So before I give birth, I have this one breastfeeding workshop. Where you have a doll and or like the puppet nipple. And they show you, mouth wide open, and they show you the technique. And this is before you give birth. So obviously when you're holding a real person, like that kind of, like I remember the mouth has to be open, but I don't remember and you're holding this fragile child. And I'm afraid to like smush her head. And it's just very nerve wracking. So at the hospital, I was quite lucky that the nurses were checking that she was properly latched and, if I was in pain or not. I come home and the CLSC nurse shows up. Again, very lucky. I had an amazing CLSC nurse who properly showed me how to do it. And I thought I was doing a good job. But then, like you said, about a week and a half later, Maya kept latching and latching and latching and latching. And I was like, what's going on? Like, why? Like, we were doing so well, So I want to know, let's talk about technique first, because I guess that's the base of everything. So what is proper technique? Like I know you can't physically show us, but I want to know what proper technique is and what to look for to have a basic fundamental, like to start a good breastfeeding experience. And then we'll get into like the troubleshooting of what can happen.
Right. So 100% before you actually have this person who's got to go somewhere on your body, even me, I wasn't a lactation consultant before my first was born, but I was like, oh, I know what I'm doing. And, you know, how could it be so hard? Like,
you'll just plop it on and they'll drink. They'll know what to do.
Yeah. So, and then you have the baby, you're like, this is really, really hard. It's a lot of angles and geometry.
Yes.
Math comes back. So don't forget your math from elementary school. It's really important. And so the basics are, I'm going to get a doll.
Yes, that would be great.
A dolly and a boobie?
Absolutely.
The basics of breastfeeding there's two things, the positioning and the latching. And the positioning is actually, yes, we talk about these different positions where the football, where we have the cradle. People have some called the koala, or in French, califourchon, or biological position. The basics are that you want the baby's body to be straight from their head to their bum. Okay. We want this alignment. Okay. We never want the baby to be twisted.
Okay.
Okay. Really important. A lot of people have this vision of they hold the baby like this and their baby's like on their back and they're twisting their head. Okay. So kind of, if you think about it, I would be really uncomfortable if I had to drink my water or eat my food like this.
Yeah.
So just how you would want to be straight, we want them to be straight. So that's the first thing. So in every position, the baby is always straight. And then you can just shift the baby in any position you want, keeping their body straight. So if you imagine your nipple is the middle of a clock.
Okay.
That point in the middle of the clock, and the baby is the hand of the clock.
Okay.
Wherever baby is, they're going like a clock. Okay. They're circling around. You're not twisting them away in different positions. You're keeping them always straight, whether it's this, even football. People imagine the football is like this. They're twisted. No, the baby is always straight. Okay. And you can always keep the baby straight. So that's how I like to think of the positioning. And then whatever position you decide to try, whatever, it doesn't matter the name. The point is that the baby is nice and straight. And the reason for that is there's not twisted, so that the tube that goes from the mouth to the stomach is straight, but also that they feel you completely. Okay. And they're even. If they're kind of half on, half their body touches you, half their body's floating in the air. So they kind of get confused. Babies really like symmetry. Okay. So that's the first thing. The next thing, and all of these positions have the same basics, it's just where they are on your body. The next thing is before we're latching the baby. Okay. So yes, we're getting to latching. So first thing, yes. Okay. So let's say we're doing this cradle position.
Right.
Okay. We're holding the baby either cradled with one hand or cradled with the other hand. It doesn't really matter. When you're bringing the baby
to the nipple,
okay, we want to kind of come from under.
That saved my life when someone told me that. So what do you mean by under? So
under.
Like
so
you're
this
scooping
is under.
it.
So the chin is in.
Yeah.
If you're coming from over, the nose is in. Okay. So if the baby's nose is in, they are going to get a shallow latch. They're going to have to kind of hold on for dear life with their lips and their gums, which hurts a lot. And also they can't breathe. Their nose is big.
Right, exactly.
So really the idea is whatever position, we're coming from under.
So can you show me how you would latch the baby on to the, like how would you physically latch the baby on the breast?
So if I was doing a cradle position, I'd have my nice pillow.
Yeah.
I have my breast.
Yeah.
I'm coming from the other side and bringing baby this way.
Okay.
I'm not starting here in my armpit. Go away from your armpit.
Okay.
Okay.
And the baby's kind of going like this.
Right.
Okay.
Exactly. So you know how you eat a big hamburger?
Yeah.
and you kind of open your jaw to go over. If it's a really big hamburger,
go over.
You don't bullseye it.
No.
You're kind of coming from under. You go right for it. No. So the idea is it's not a bullseye.
Okay. It's from under to over.
There's more emphasis on the chin and the lower part from under the nose being really close and buried versus straight or the upper part.
And is it true that if you go, like you say, from under, it'll help the baby with opening their mouth wider to scoop the nipple in?
Yes.
Right?
Because a lot of people, and this is kind of what they teach in the hospital is like, okay, wait for the baby to open their mouth and bring them on.
Yeah.
Okay. That doesn't work. Babies have reflexes. And the reason they're born with these reflexes is so they can drink and survive. So the gape reflex, which is just opening your mouth, a gape is your mouth open. Babies have this reflex. Okay. And how do you get this reflex? Is by touching from the nose to the chin. Okay. So if you're waiting for the baby and the baby's away from the nipple and you're waiting for them to open their mouth, by the time you bring it, they might have closed up.
Right.
That hurts. It's like a bite.
Yes.
Instead of having the baby kind of far away and then waiting, we bring the baby from underneath and we just place them here. The mouth doesn't have to be open yet.
Okay.
We kind of just let them be here and the nipple points up between the nose and the lips.
Yeah.
And they're touching completely.
Okay.
That feeling of touching gets them to open their mouth. Okay. It's not, everybody's like, oh, rub the nipple, do this.
Yeah.
You know?
Yeah.
This kind of, it's like if I was holding a hot dog in front of your face and going like this, right? Like if I'm going like this, you're like, where's the hot dog? Okay. So we place the hot dog.
I'd probably get the hot dog.
You're going to get the hot dog.
Yeah.
But you're going to be confused.
Correct.
You're right. Go like this. Like you see the baby
like
going
a
like
dog.
this. You're like, what's going on?
Yeah.
So instead of waiting for them to open their mouth and then trying to put them on, we place them here from underneath, just touching. No pressure to open and to go on. It's just touching. And then because they feel it, they'll open reflexively.
But will they open wide enough?
I don't know.
Because that's like the kicker.
I don't know. If they don't open wide enough, there's some other stuff going on. Okay. But it gives them the best chance to have the widest mouth by doing that. And then let's say in this position where you are helping guide them, you place them here, they feel it. When they open their mouth, then yes, you're going to use your hand at the nape of their neck and help guide them on.
Perfect.
Okay. But they're going to open up big. They have a nice open neck. It's like drinking a cup of water. We're opening our neck. We're not going like this. Nice open neck. They open wide and then you guide them on. Okay. That's kind of the basics. And every position, you could do it in football. You place it like this. In this kind of diagonal position, same thing. They're still having that feeling from nose to chin. And then they open up.
Yeah. And correct me if I'm wrong, but what I experienced, so when the CLS seniors showed me that you really have to scoop, I call it the scoop.
Yeah.
Like you can't be afraid I was too afraid to kind of really scoop her because she was so little and fragile. Yeah. I didn't want to like aggressively scoop her on my boob, but you have to be a little bit,
They're not as fragile as you think.
Right.
They're quite tough. They got through the birth canal or like they survived major surgery and you don't see what's going on. But a C-section, they're pulling the baby. They're not as fragile as you think.
Yeah.
So they really can handle being held kind of in this position.
Yeah.
And if you place them here comfortably and also you have support, their body is being held and all you're doing is guiding them from here. This around the neck is very safe. Now, I never want to hold the baby here because they will be very uncomfortable and you will be terrified. Okay. So this position here, yes, it's kind of like a quick, not necessarily aggressive move, but quick and like you make it quick and you make it like you want to get it in. You really want to get it in as deep as possible because that'll decrease the chances of pain and problems.
And what is a normal amount of pain? What is a normal amount of discomfort? What is normal?
So normal is pulling and tugging, especially if it's your first.
Yeah.
So So your nipples have never had this kind of sensation for long periods of time.
Right.
20, 30, 40 minutes is a long time to be like that kind of action on any part of your body. So it is normal that there will be a feeling of pulling, a feeling of tugging. Tissue gets loosened up over time. So that's why like a 4-month-old baby, if it looks like they're pulling mom, but she's not uncomfortable because her skin is stretched, the inside the nipple has stretched. So it doesn't hurt as much.
Okay.
But at the beginning, and especially first baby, there is definitely sensations of pulling and tugging and sometimes pressure. But the second it heads into pain land, and it could be 1 on 10, it could be 10 on 10, we want to make sure that we decrease it as quickly as possible.
Okay. So I guess one of the first factors, or one of the like most common factors you see at the beginning of an issue would be pain, right? Like,
I mean, I would say probably like 80%
Yeah.
of the time people are coming in
It hurts.
having some sort of pain. Yeah.
So what is the first thing you would look at if someone is saying it's really hurting when I breastfeed? Like Catherine, for example, it was so painful.
Right.
What's the first thing we would look at?
So we don't go looking for problems. The first thing we do is latch in position.
Right.
Because that's the basics. And many, many, many people have not had,
Proper
their
explanation.
proper explanation through a class, or their parents and even grandparents now have not breastfed. So that skill wasn't passed down.
And you think you're doing it right when you're not.
Right.
I think that's really the major thing. Like you
think correct or right means it's comfortable and happy and you and baby are doing well.
Right.
So it doesn't have to look exactly the same for everybody.
Okay.
But the idea that we have this idea of holding kind of the baby like this and bottle feeding, and that has translated the vision of feeding the baby and breastfeeding. Whereas in the past, it was the knowledge has been passed down to put the baby on the body, to allow the baby to go for the breast themselves. So there's been a lot of changes, let's say in the last 100 years, of how we teach breastfeeding versus before it was passed down from the midwife and your mother and your sister and your aunt who did it themselves. We're absolutely looking what I just talked about, the latch in position. I optimize it for every mom.
Okay.
And we sometimes do the position that you've already been doing and we just kind of tweak it. Sometimes we try new positions that you never tried before or that you have tried and didn't like. Sometimes we do the same position. We add a different pillow or take a pillow away.
Okay. So physical things.
Physical. We put lean you back, we figure out what works for you.
Okay. And then so if the positioning and the technique is all good, what do you look for
Then
after?
I go looking for problems.
Right.
Okay. If that hasn't helped, then I go looking for problems. Sometimes there's pain because there was already damage. And let's say the new position would be great, but there's damage. So we're always trying to heal any damage.
So you mean like blisters,
cracks. Things like that, any sort of nipple problems themselves.
Right.
So always healing up the nipple, depending on what the issue is. We have different things to do. So that's also kind of like latch in position, nipple healing go together. And then if that's not working, we look deeper. Is it something like, is the breast, where is the pain? Is it inside the nipple, in the breast? So it can kind of give us an idea of what the problem is. Is it a skin condition? Is it dermatitis? Is it eczema? There are many different causes of pain. So if the latch in positioning doesn't fix it, we look for, okay, you have this kind of pain. This is your symptom. It is, on your side, you have poor circulation. This is why you're in pain. Oh, you have eczema or you have some other skin condition. This is why you're in pain. Most often, it's from the baby's latch.
Yeah.
Okay.
Yeah. And so after that, in my case, it happened a little bit, but in Catherine's case, it happened a lot. Baby is like all of a sudden latching, unlatching, and things are not going well. Why?
So it's very confusing because it could be like in Catherine's case, a lot of milk, very fast, but it could also be not enough milk. Okay. So we delve deeper. Are you having to give supplements of your breast milk or formula, which means the baby can't get enough? Are you not able to pump enough, for example, for the baby? So you have not enough supply. So baby's frustrated from the lack of flow. Do you have a ton of milk and baby's just being like car washed with milk?
Yeah.
We look at these different aspects of, okay, but your milk supply seems good, but baby seems frustrated. Are they very sleepy? Do they seem like they're in pain? Is there some sort of like reflux symptom or something? Is baby fine, but mom's always in pain? Like there's so many different combos. So with each thing, it's a dyad. So we're looking, both parties are very important. It's not just one or the other. So kind of like taking those the clues from each side and then kind of going on from there. If baby's great and gaining well and happy and comfortable, then it's generally, okay, there's something going on with, let's say in their mouth, and it's causing mom to have pain. Or baby's really upset and fussy and barfing all the time and, gas or green stools. Okay, well, mom might not be in pain, but she might have a ton of milk and the baby's just getting the high lactose milk and very uncomfortable.
It could also be something in mom's diet.
Could be an allergy, could be a sensitivity. Yeah. There's all these things that kind of overlap as well.
Right.
So sometimes we have these, what we call differential diagnosis. What could it be? Mm-hmm. And sometimes it's trial and error. We try a few different things and we say, okay, this is the symptom, but this symptom could be this, this, or this. Yeah. So I'm I call myself a detective because like I have to figure out which path to go down. Because it's not like I broke my arm, I put in a cast, it's healed. It could be A, B, or C.
And why does this happen weeks after things are going well? Like, is there something that happens in the baby?
So
or the milk? I don't know.
So sometimes, I would say I see problems at 3 points. Right away. Immediately within that first week of birth. Okay. I would say that's right away. Second point of problems coming up is around that 3-week mark. Mm-hmm. And that's because the first few weeks, the baby's volumes of intake are quite low. So it could be mom has enough milk for that moment, those first couple of weeks where the intake is a little bit lower, that the baby's fine, they're growing well, but then 3 weeks hits and mom doesn't have supply. Or there's a 3-week growth spurt. That happens a lot where the baby's just fussy all the time and really hungry. So they build up mom's supply, and it could have been that when the oversupply came. Because the baby was just revving up that supply. Also, that's the point where people are like, I don't have enough milk, my baby's starving all the time. And then they question themselves. Yeah. So it's a perceived problem, even though it's a normal thing and you just wait it out.
When does the milk come in, by the way? Like
so
at a normal
colostrum
pace?
Is milk.
Yeah.
Right? So there's a continuum. So there's colostrum, transitional, and mature milk. Colostrum generally is 2 to 3 days. Mm-hmm. This transition time is somewhere between 3 to 5, and then it goes into the higher volumes from then. Mm-hmm. But your supply keeps increasing that first 4 to 6 weeks, generally. But each baby you have, you make more milk. So sometimes second or third, your milk comes in faster. Okay. Some people, day 1 in the hospital, tons of milk. Some people, almost nothing till day 10. There's so much variability. There's medical issues that happen that can affect that. There's baby issues. So if the baby's not latching well and you're not removing milk, well, you're going to have a slower coming in of the milk. There's a lot of different factors that affect that quantity of milk availability for the baby.
So if I understand, like, there's a few things that we can do to have a comfortable breastfeeding journey, like learn how to latch properly, like you showed us, and, the few things that we can look out for. But there's nothing that we can do to prepare ourselves to have a perfect journey. Like anything can happen. It's a lot of, the mom on the milk side and the baby on the physical side. So it really is trial and error, just like you said. I want to ask you, I have a lot of friends. Me, myself, I didn't have that much of a tough time breastfeeding, thank God. But I do have a lot of friends that really did have a tough time. And when they tell, like you, so great. So you can tell me. And when I hear their stories, I can't imagine the stress and anxiety and the lack of sleep and the guilt and, everything that goes along with it. So when is it okay for a mom to say, enough is enough? I haven't failed my child just because I can't breastfeed or I choose not to because I'm in too much pain. Like, explain that a little bit.
So there is no best time to stop. It's when you have decided that for you, your body, your mental health, that it's safest and best for you not to breastfeed. And as long as the baby is fed appropriate milk, then there is absolutely no problem to stop breastfeeding or pumping or formula or any combo. Okay, at any point, however old the baby is. The only thing I will say is don't make a decision at 2 a.m.
Okay.
Okay, because our hormones are massively connected to the time of day and circadian rhythm, and making a decision when we're at our lowest low can be really hard because then let's say you feel better the next day or a few days after, you might feel bad about it. It's okay to make that, let's say that feed's not going well. It's okay to do something different, but saying I'm stopping and then completely stopping at 2 a.m. Nothing good happens after 2 a.m.
Right. Agreed. 100%.
20 years ago and today.
Absolutely.
So that would be like my first thing. Don't make your decision at your lowest point. And then don't make an uninformed decision.
Mm-hmm.
So, I don't like this fed is best, breast is best, formula is best. There's nothing best because what's best is so unique to each baby, mom, family unit. What is important is information. So if you are informed and you feel informed for you, my level of information is different than yours, different than yours, and different than yours. As long as I have the correct information for me and I feel great about it, then any decision you make will be perfect because it'll be your informed decision. Making decisions out of fear, out of Dr. Google, out of, guilt,
Yeah.
Internet groups, pressure, friends,
yeah.
family. Those are not the people who are informing your
Even
decision.
spouse or whoever.
Sure.
Yeah.
So it's you and your baby. And yes, there should be, consideration taken from the spouse. But in the end, if your body is feeding the baby, you have the majority of the decision-making power. So as long as you get the information that feels right for you and you feel good about it, there should be no guilt, shame, problem, stopping breastfeeding, starting something else, switching formula. It doesn't matter as long as you feel good about it.
And just because you stopped breastfeeding or you're no longer giving your baby breast milk doesn't mean that they're going to get sick at daycare more.
No.
It doesn't mean that they're going to have less of an immune system. It doesn't mean, right?
Maybe, maybe not. The information is not good enough to say that.
Okay.
So what's important is that the food you're giving your baby is safe and appropriate for the baby, and that is more important. Having a family that is well mentally and emotionally is more important than anything that breast milk could give to the baby.
I love that.
So it's not black and white. It's super gray when it comes to this information between breast milk and formula. There's tons of scientific information out there, but in terms of the emotional, mental, physical part of it, that has nothing to do with the nutrition. Nutrition is one aspect, but nutrition should not trump if you're happy with your baby.
Mm-hmm.
And of course, there could be other factors that affect your emotional well-being when you have a baby. But if feeding is part of it, getting the right help and asking the right questions and, feeling supported, and that will lead you to the best decision for you. I will support you in any choice you make. It really doesn't matter to me how you feed your baby. It's my baby, your baby.
Yeah.
I just want to make you feel good and give you the correct information. And also, I have moms who are weaning who need help to safely wean.
Yeah.
They decided they want to wean. weaning on the fly is also not safe necessarily, because if you're going from a full milk supply and you're trying to wean, you can make yourself sick. So I'm there too to start the journey and to finish the journey, because at any point, whether your baby is 1 day old or 4 years old.
On that note, can I ask you, the majority of your clients or the moms that you work with, at what age do they stop weaning? Do they start weaning their? Do they start weaning
I don't
their baby?
know, because a lot of the times, once I see them once or twice, and then depending if things are going well, I don't necessarily hear back from them.
Okay.
Or if things are not going well, then they generally need a higher level of care, and they're being seen by breastfeeding clinics, for example. I generally ask, keep me up to date, but I don't get that information for the most part.
So when do you? Well, no, not.
I
when
would
do
say
you
a
think?
lot of people wean if things are going well. I think a lot of people wean somewhere between 1 and 2.
Yeah.
A lot of people when they start daycare.
Yeah.
Most people start daycare between 10 and 15 months.
Yeah.
But I could be completely off.
Yeah.
I have no idea. Realistically, I don't know.
Thank you very much for all that. It's really great information. I'm happy that you took us through the whole breastfeeding journey and especially the techniques.
There's more, but that's just get you started.
Yeah, perfect. Thank you very much, Naomi.
No problem.